update from Governor Roy Cooper on coronavirus in the state.
132 cases, 1,495 new cases reported since yesterday, 956 people in the hospital, and sadly, 3,532 people who have died. Our thoughts are always with those mourning a lost loved one or fighting this disease. Today, we're cautiously encouraged about where we are in this pandemic. The key indicators we watch in North Carolina remain mostly stable. But I have to tell you that we see warning signs that the disease could spike again, here and across the country. The virus continues to spread, so we must take the next steps methodically and responsibly. And we must rely on North Carolinians taking personal responsibility to protect others by wearing masks and keeping their social distance. Our top priority remains getting children back to in-person learning at school. This marks a major shift for many families now and in the coming months, as many schools open their doors, some for the first time since this pandemic. Our stability is fragile, and with cooler weather and flu season comes new challenges. While we are methodical and cautious about easing restrictions, we need to keep using proven measures, wearing a mask, waiting 6 feet apart, and washing our hands often. But before we discuss the next phase, I'll ask Dr. Mandy Cohen, our Secretary of the North Carolina Department of Health and Human Services, to walk through the data. Dr. Cohen.
Thank you, Governor. Those 3 W's are going to be critical to protect the progress we've made. So let's dig into the data. As a reminder, every week we look at a combination of trend metrics. We look at COVID-like syndromic cases, new cases, positive tests as a percentage of the total tests, and hospitalization. Together, these 4 metrics give us a complete picture of where we are today. And as you'll see in the data, we are stable, but as the governor said, fragile. In our first graph, we look at people who come to the emergency department with COVID-like symptoms. This is our earliest detection mechanism. Taking a look at the yellow line, you can see that this yellow line ticks up just slightly. This slight increase shows that we are at this fragile time and we have work to do to keep us on track and keep that viral spread low, and we really want to see this trend decline. Next, we look at new cases. This first graph gives you a look at the trajectory of new cases each day since we had our first case back in March. The yellow line shows our peak of cases back in July, then a slight bump in August corresponding to this reopening of universities and colleges, and then a decline to the cases at their current level. But let's zoom in to get a better sense of the current picture, particularly over the month of September. On the positive side, we are currently below our peak from July and August. However, you can see that when you look at that yellow line, our cases have leveled. While overall a leveling of this trend is a good thing, we want to continue to see our cases decline. We are seeing higher cases, particularly in the Northeast and Sandhills area of the state, but we all need to be working hard to prevent viral spread. Next, we look at the percent of tests that are positive. Here we see a positive trend. We have been at or just under 5% of tests coming back positive over the last 2 weeks. This positive trend is because of everyone's hard work. But you'll also notice the last 2 days, our percent positive ticked back up to 6%. So we must continue to work hard to keep our progress going. On our next graph, we look at day-over-day hospitalizations. You can see from the yellow line that this trend is level, and we maintain sufficient hospital capacity. So, okay, here's where we are. Surveillance data trended up very slightly. It gets a yellow line. North Carolina's trajectory of cases is level. It gets a yellow line. North Carolina's trajectory in percent of tests returning positive is level. It also gets a yellow line. And North Carolina's trajectory of hospitalization is level, but still high. This gets a yellow line. Now, to the capacity indicators. Regarding our testing capacity, folks are getting their results faster, and we're continuing our surge of no-cost testing events into October. However, we still want to see more testing being done, so this measure currently gets a sideways arrow. We continue hiring contact tracers to bolster the efforts of our local health department, and we've also launched our new exposure notification app, Slow COVID NC, so this metric gets an upwards arrow. Our PPE supplies remain stable, and we continue to distribute PPE across the state. However, the federal government is now paying for less, only funding PPE for healthcare workers, and not for places like school staff. So this indicator also gets a sideways arrow. Our steady, evidence-based approach has kept us from those dire circumstances other states have faced and has allowed us to responsibly ease measures. The day in, day out hard work of North Carolinians is making a difference. But, as I've said a few times, our progress is fragile. We cannot take anything for granted. Across the country, cases are beginning to increase again, particularly in the Midwest and the South. We're seeing a similar trend in countries around the world. So we're going to need to double down on our work to slow the spread of this virus to keep on the right track. The good news is we've seen what's possible when North Carolinians come together. We avoided the first and second peaks that much of the country, particularly the South, experienced. We can protect our progress by doing three things. First is practicing those 3 W's, wearing a face covering over your nose and mouth whenever you're with people that you don't live with, waiting 6 feet apart and avoiding large gatherings, and washing your hands frequently with soap or water or using hand sanitizer. Second thing, downloading the Slow COVID NC app so you can know if you've been exposed to the virus and can act quickly to protect yourself, your family, and your community. More than 80,000 people have already downloaded the app, so we're off to a strong start. And the third thing, things that you can do to protect your family right now, is get a flu shot. The governor and I got our flu shots last week. And remember, whatever your reason, get behind the mask. Thanks so much, Governor.
Thank you, Dr. Cohen, and thank you for your leadership. We're encouraged to see North Carolina holding steady, and because of our stability, today we're taking another careful step forward. North Carolina will move into Phase 3 beginning this Friday, October the 2nd at 5 p.m. So here's what'll change. First, our at-risk population is still safer at home. For those over 65 and those with health risks, we urge responsibility in your choices. For everyone, a face covering is mandatory for those over the age of 5. As the head of the CDC said, a mask is the single best tool we have against this virus. So in this new order, large outdoor venues with seating greater than 10,000 may operate at 7% occupancy for spectators with other safety protocols, as we previewed last week. Similar outdoor entertainment venues, like arenas or amphitheaters, may operate outdoors at 30% of outdoor capacity or 100 guests, whichever is less. Movie theaters and conference centers may open indoor spaces to 30% of capacity or 100 seated guests, whichever is less. Bars may operate outdoors only at 30% of outdoor capacity or 100 guests, whichever is less. Outdoor amusement parks may open at 30% occupancy. The limits on mass gatherings will remain at 25 people indoors and 50 people outdoors. The 11 p.m. curfew on alcohol sales for in-person consumption in locations such as restaurants and now outdoor bars will be extended. Phase 3 continues our state's dimmer switch approach to easing restrictions, and it will be effective through Friday, October the 23rd. I believe that North Carolina can do this safely. But so I'm clear, every gathering carries the risk of spreading this disease. Being safe means being smart, and making sure others around you are doing the same. If you're still at high risk, you're still safer at home. If you're going out, do what works. Wear a mask, keep social distancing, wash your hands often, and don't patronize or go to places where people aren't doing that. Until we have a vaccine or a reliable cure, precautions like the 3 W's are with us for a while. Our children can go back to school, and our economy can fully rebuild when we're safe and people have confidence that they can stay healthy. Every careful step we make forward, and every time we wear a mask and keep our distance, we are helping to keep this disease at bay and building a stronger North Carolina. Along with Secretary Cohen today with me is Emergency Management Director Mike Sprayberry. Nicole Fox and Brian Tipton, our sign language interpreters, are with us today. And behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We thank the media for being with us today. We'll take questions now, beginning with the first one. If you can identify yourself.
You've been listening to an update from Governor Roy Cooper and his coronavirus task force in Raleigh. We have just learned that our state will enter phase 3 of COVID restrictions on Friday evening at 5 o'clock. We're going to break down exactly what that means and how it impacts the triad coming up this afternoon on WXII 12 News. We'll return you now to regular programming.